Welcome to the Tell Her podcast, where extraordinary, ordinary women share real stories of resilience and courage.
Let's go for it.
So welcome to the podcast, Leah. Shall we just get straight into it? Because for some reason I have this really long intro that does all the intro anyway, and then I repeat myself. So let's just go straight in. She is a hair loss specialist the same as me, and we met a few years ago when you came to me for some training.
Yeah.
And it was a really lovely experience, actually, because your mum came along and you explained to me why you wanted to become a hair loss specialist. So should we just get straight into it about what made you make that decision to be a hair loss specialist?
Let's go for it.
Let's go for it. Straight in there. we were both just saying off camera that like the start of an interview is it can be awkward because it feels like an interview and we don't really want to have that interview style. I feel like we should just have a conversation.
Yeah,
like
definitely not confident.
But you're definitely confident now in your work.
Yes, I definitely feel more confident than when I first started.
So what made you decide then, if you want to tell the listener?
So I decided to go into hair loss because in March 2022, I was diagnosed with breast cancer and I lost all my hair. And I had some experiences that maybe weren't the best.
Okay.
And it's taught me not to be like that.
Yeah.
And I used to be a hairdresser. And then I started doing some Googling near the end of treatment and I came across Shani.
Oh.
And what made me go for you is because what you do is what I wanted to do.
Okay.
I don't want to do the normal hairdressing. I want to do the mesh integration, wigs, toppers.
What made you decide not to go back to traditional then? Was it your own experience that drove you to want to make a difference for other people having that experience?
Losing my hair was a massive thing for me.
Yeah.
Like some people, when they get told they've got cancer and they're going to lose their hair, it doesn't bother them as much. But there are some people out there that does bother them. For me, I'm not a confident person. So for me to lose my hair was a massive thing. My hair used to literally be down to here. And even before I started treatment, the thought of losing my hair was a massive factor.
Mm.
And yeah, when I started losing my hair, it really knocked my confidence. And yeah, that's when I decided, when I started going to wig shops. I had mesh integration first.
Okay.
And then I started going to wig shops because I'd lost all my hair. I started to realise that this is something that I would enjoy doing.
Yeah.
And with my own experience of losing my hair, I understand how hard it can be for some people.
I feel like that's really important. That came through really quickly with you as well.
Yeah.
I think when you came to me, were you still wearing a wig?
I had just finished treatment, literally just finished radiotherapy.
That's crazy.
Was it like a week? I don't even know if it was a whole week before I came for treatment. And I turned up on my wig and mine was a panic buy. So it wasn't the most comfortable.
Okay.
And I remember you saying you can take it off, but I wasn't confident to go with nothing. So I shoved my turban on.
Oh, God, I forgot about
Yeah, I didn't wear the wig long. I popped it on the side and put my turban on.
I completely forgot about that. God, isn't it weird, like, the things that you remember and you don't remember? I only remember you wearing the wig, but obviously that would have been significant to you.
Yeah.
But to me, it was
so
just
then I was
quite normal.
I was more comfortable.
Yeah, actually.
And I felt confident doing it in front of you because you're used to seeing people.
Yeah. Yeah. And your mum came along, didn't she?
Yeah, you was my model. Yeah. Good old mum.
And she was lovely, very supportive.
Yeah.
If we wind back a little bit,
Yeah.
because obviously you've been on your own cancer journey.
Yeah.
You're still kind of on it now.
Yeah.
You're still having operations and stuff like that. So I think it's really important for people coming into the industry to understand what it actually means to somebody when they lose their hair.
Yeah.
Because I think when you come in with ethics and empathy, you're always going to want to do a good job.
Yeah.
And you're not going to be money driven.
Yeah.
Because obviously within our industry, there are opportunities business wise. So sometimes that's not always a great thing because
No,
people
I
are doing it
do.
for the wrong reason.
I do actually see people advertise who do training for mesh integration.
Yeah.
Do mesh integration, you can earn X amount.
Yeah.
And to me, that is the wrong reason.
Yeah.
You're just doing it to get as much money as possible rather than putting a smile back on someone's face, giving them as much confidence as possible. For me, when I have a customer that does, literally, you see their face at the end of it light up and they're sending you messages.
Yeah.
I'm so confident to walk around Sainsbury's and stuff. Or I get such lovely reviews that it actually chokes me up.
Yeah.
And I love it. I can honestly say it's been a hard way to get to this.
Yeah.
But yeah,
It's like
it literally chokes me up seeing their faces.
Like the silver lining.
Yeah, and they're like, I can't go without it now.
Yeah.
This is me.
Yeah.
This is the new me. I love it.
Amazing. And I've really loved watching your journey. That's why I really wanted you to come on, because I feel like you are the, like, we were saying about big words and brain fog, and I've just got it now with words and
I've
brain
got it all
fog.
the time.
But you are like, for me, the perfect example of like the journey through learning, the mastering, and then implementing and aligning with clients, and then like the joy that you get from it as well at the end. And I think all of that, I do, obviously I've never ever been through treatment. I've never experienced anything like that. And I just have to try and pull on other people's experiences to make sure that I'm really thinking outside the box, and make sure that I'm empathic to what's happening. But I think for me, because I believe that if you would do everything the right way, you will be rewarded anyway.
Yeah.
And part of that reward is that you can provide for your family financially and all that kind of stuff, and that your client values you. So I hope that makes me level. But I think somebody like you who's doing it because you've actually experienced it, it's a whole different.
Yeah.
For you, it's completely different, because you obviously do get the reward, but like the whole experience is just amazing. And now you can really help them through that. And do you find that like you can see if that person is actually ready for mesh integration? Can you tell now, have you gained that skill?
Yes and no.
That's a hard one, isn't it?
It is.
Yeah. It's like, it's such a big commitment from everybody involved.
It's a massive commitment. Obviously, the price is a big factor, and that stops. I have some people come for consultations, and that does stop them because of the price and the ongoing price of it.
Yeah.
But they've also got to be willing to put the effort in to look after it.
Yeah.
Otherwise, you're spending all this money. The hair's not going to last you long.
No.
And it's not going to look as good as it can.
Yeah. You need to protect their investment.
Yeah. And you've got to get on with that person. You're with them all the time.
Yes.
So getting someone that you align with and
they communicate with.
Yeah.
Yeah. That's massive for me. Like, we both had experiences, haven't we, in the past where you can't communicate with somebody.
Oh, yes.
Yeah. And it is devastating on both parts.
It is. And it does knock, for me, it knocked my confidence.
Yeah.
I remember saying to you that I don't know if I can do this anymore.
Yeah. I have.
Because it knocked my confidence massively.
Yeah.
And then when you get the right customers, it picks you back up. And I was like, right, this is why I'm doing it. I can do it.
Yeah. And that's what we was really working hard together, weren't we, both with different experiences.
Yeah, but even when I'm going down, when I speak to you, you pick me up. I'm like, right, I can do it now. Let's get on with it.
Yeah, because there are so many people out there that do want this service and like do want to put the effort in.
Yeah.
But I think part of our job, and that's probably what you've mastered now as well, is making sure that they understand the service and what it actually is and what it entails. Like you were just saying, it's a big financial commitment.
Yeah.
It's a big emotional commitment and like alignment as well. Because just because we can do something doesn't mean we should.
Yeah. It's not, like, I say to them, it's not suited for everyone.
No.
But for the ones it is, it really, yeah,
definitely. So when I'm going to rewind right back, because we could just talk about mesh integration and stuff, because obviously you do wigs as well.
Yeah.
So if somebody's not right for mesh integration, you do other alternative care, which I think is brilliant, because you can really take care of somebody in treatment, through treatment and out of treatment, and they feel safe with you then as well. But if we go right back, because obviously with the podcast and what we were talking about earlier is how people are having to fight for the diagnoses, and
Oh, yes.
they're like, it's a lot bigger than pink ribbons and ringing the bell and all that other
Yeah.
stuff. There's just so much more to actual treatment and
Yeah.
why people end up sat in our chairs.
Yeah.
So I thought if we kind of share your story, if
Yeah.
you don't mind,
No,
if
that's
you're
fine.
comfortable. So how old were you when you were diagnosed?
I was 30, nearly 31.
So young as well.
I remember I grabbed my washing from upstairs, put it in the washing machine downstairs, so I had the pile in, and I thought, oh, that's sore. Dropped the washing pile, and I felt, and I could feel this big lump. I thought, and I'm going to be honest here, I didn't actually check myself before.
Right.
Whereas now I'm like, first of the month, check your boobs.
Oh, do you do it like regular?
Yeah.
Amazing, yeah.
So I felt the lump and I was like, it was a Friday, and I thought, I'm not going to get a doctor's appointment now. And my son, my eldest son, had just had chicken pox.
Right.
And I remember getting booted by him trying to get the lotion on.
Oh.
And I thought, has he accidentally hurt me? So I waited till the Monday and I called the doctors, went to the doctors, and it was painful. And she said, definitely cyst. She's like, does breast cancer run in your family? I was like, no, cancer has. I've lost quite a few family members from cancer. And my mum, hopefully she don't mind me saying, she suffers with cysts to the point she's had some drained.
Okay.
So she's like, definitely cyst. I'll come back in 6 weeks.
6 weeks.
6 weeks. Wait for hormones. I don't really get periods because I've got polycystic ovaries.
Yeah.
So I said that, and she's like, wait 6 months, come back. And it was really painful. Like if the kids were sitting on me, leaning, I'd be like, ooh.
Yeah.
And it was I can't remember if it was a week or two later. I was about to get dressed. I took my pyjama top off, put it on the bed. I was getting dressed and I looked over, thought, what's that? There was blood on my top.
Oh.
I actually had blood coming out of my nipple.
Oh my God.
Called the doctor.
Yeah.
Definitely infected cyst. I was like, okay, she wanted to put me on antibiotics. I can't really do antibiotics. I've got celiac disease and IBS. I can't do it.
Yeah, of course.
And I kept complaining. Eventually, I got put on the 2-week wait. But the 2-week wait, because of the backlog from COVID, was 8 to 10 weeks.
Wow.
So I took myself off to A&E because I wasn't feeling that well.
Yeah.
And I sat there for absolute hours. I said about the pain. They just gave me oral morphine and said, you're going to have to wait. Filled it and said, you're just going to have to wait for your appointment. And it was my mum and dad went, book a private appointment.
Yeah.
I got in the next day through private.
Yeah.
And I saw him straight away and he pushed and it was bleeding. And he sent me round to get an ultrasound.
Yeah.
He went straight away. I was on my own as well because you weren't allowed anyone with you. Mm. And I didn't think to bring anyone with me because everyone's going, it's definitely cyst. Went back round and I was on the waiting room on my own. And I was thinking, this don't sound good. Mm. And I went in and he works through NHS as well. And he got me in the next day before I'd even got back in the room to have biopsies the next day. And I was a bit naive. I was like, well, what do you think it is? He went, do you want my honest opinion? I went, oh yeah. He went, the shape of it's cancer. I was like, huh? And I kind of just went, and I had an appointment the next morning when he got me booked in. The nurse went, come into my office. So I went off to her office and it still hadn't really hit me. I was more like, oh, I'm going to have to call and cancel this appointment. Call and cancel this appointment. I was like, okay. She was like, you can wait a bit. I was like, no, I'll go. I started walking. I remember I was trying to get hold of my husband because the kids were at a childminder at that point. I was like, you're going to have to finish work and you're going to have to pick the kids up. And I remember, I think he forgot where I was.
Okay.
I remember going, I can't just shut the wash plant down. I was like, no, you need to. Yeah. And I remember telling him, no, they've just told me that they think I've got cancer. He's like, oh. God. And then I got in the car, sat in the car and I got myself in a state.
Yeah.
So then I'm trying to call my mum and dad and they weren't near me. God. So then I remember driving back to my mum and dad's because that's closer than home. to just breathe for a minute before going back to see the boys because I didn't want the boys to see me upset. And the next day I had the biopsies. I think that was a Wednesday. And then I got the results on the Monday and I took my husband with me.
Okay.
And my mum and husband kept going, no, it's definitely not cancer, definitely not cancer. But deep down I was a bit, And I sat down and they literally turned around and I got the words, I'm sorry, Leah, but it's cancer. And I was literally, and my first thing I said was my boys.
Yeah.
Because at the time, Callum was only 1 and Ethan was 3. So for me, I was like, my boys, and it just like flashed through me like, I don't want them growing up without me. I'm their mummy. And then the second thing was, which people might laugh at, I was like, my hair. Will I lose my hair? Yes, you're going to lose your hair. And I walked out of there and I just broke down.
Yeah.
And I remember saying to my husband, like, I can't tell my mum and dad over the phone. And my mum works at primary school. Okay. So I knew she was still at work. So we drove to the school and she came in. And I felt awful. I was like, I'm so sorry, Mum, but I've got cancer. Because I knew it would break them. I'm so close to my mum and dad. And then my husband cried. And my husband never cries. He's not emotional at all. Yeah. So it was kind of a whirlwind. So I was just turned 31 when I got the diagnosis. But there was a backlog then and I wanted to try the cold cap.
Okay.
And I was under Broomfield in Chelmsford. They didn't do cold cap then. So I had to go Southend. Right. So I did the first one with a cold cap. But I got the diagnosis on the 21st of March. And then I didn't start chemo till May. There was no chair for me.
What? That's insane.
Yeah.
That's that whole timeline is just so from
because from the biopsies and I had a PET scan, so a full body scan, because they thought they'd just do a lumpectomy.
Yeah.
But it was all over the breast in the ducts.
Okay.
So I was told then it was a full mastectomy once they got the scan results back as well. And it was aggressive.
Okay.
It was stage 2, grade 3, triple negative breast cancer.
For anyone that's listening, because I think for somebody like me, you don't really understand what those things all mean. Do you understand like what each...
Part and part not. Yeah. Mine was just like to get through treatment, whereas my mum was more the Googler trying to understand
stage
it
2
more.
Would mean that it's in 2 places?
No.
Okay.
It hadn't gone to my lymph nodes.
Okay.
So it was just in the breast.
Yeah.
But grade 3 was the aggressive side of it.
Okay.
And the triple negative meant it wasn't hormone.
It wasn't hormone?
No.
Okay.
So I'm not on any treatment, whereas most people with hormone, they'll be on treatment for 5 to 10 years of medication after, which can thin their hair.
Yeah.
Whereas I'm on nothing, so I haven't had to be put through the menopause or anything like that.
Okay.
So then I went through 8 rounds of chemo, which was the hardest thing I've ever had to do.
Yeah. We were just talking about that in the car.
Yeah. I'm ashamed to say, but I struggled massively. I wasn't very positive.
And this is I think a lot of people really struggle with like not being the happy side of cancer survival, if that makes sense.
But the people that I saw, and even now, my customers, the ones that are more positive, I'd say they weren't as ill.
Oh, really? Like, do you think they didn't let them...
The positive mindset definitely helps. But for me, I couldn't be positive. I really struggled. Yeah. I was angry.
Yeah.
I was wanting to do things with my kids and I couldn't do things. I felt like everything had been took away from me. So there's times I just wanted to give up. Yeah. I didn't know if I'd be cancer-free at the end of it. And each time it was hard. Yeah. To me, it was hell.
It probably is to a lot of people, but we were saying in the car that it's kind of an unspoken like thing. So even, I was just thinking then, even like I'll say, oh, my clients, when they come, they're always really positive mindset. But I am always very thingy about the fact that they've probably grieved and been angry before they get to me.
Yeah.
Like, I think people going into treatment when they come for a wig in preparation are in shock.
Yeah.
And then when they come for integration, they've grieved
Yeah.
and done all of that process. Then they're like, right, let's get out.
It
the
might
other
be like
end.
their emotions as well, because some people, for me, not everyone, there's times that I was more uplifted, so then you won't get the emotional Leah.
Yeah.
And then there was times that I was down, so you will definitely get a lot of tears. But yeah, it was
Did you feel
hard.
Yeah, comfortable like just having your bad days and letting yourself have them? Like,
Not really. I really struggled because all the family members that have had cancer didn't make it. They didn't
okay.
get the chemo and that. And literally a year before I got the diagnosis, I lost my granddad from cancer.
Okay.
So for me, all I've witnessed is cancer, death.
Yeah.
So I don't think that helped my positive mindset.
Yeah. Well, I don't think it would anybody, would it? It's like, and then I suppose like you were saying earlier, you feel like you're putting up this massive fight and there might not even be the result that you want.
Yeah. And what did get me through as much as I was struggling is my kids.
Yeah.
I wanted to watch them grow.
Yeah. Because how old were they then?
Callum was 1 and Ethan was 3.
Yeah.
So I just wanted to watch my babies grow. And there's times that all I told, because Callum was too young, Ethan, I would go, Mummy's poorly. He was 3. He didn't need to know the ins and outs, just that Mummy was poorly. And the days that I were really ill, he'd come up to me on the sofa and he'd go, Mummy, I'll kiss you better. But when are you going to be better, Mummy? Oh, God.
Yeah, the kids do.
And he'll just snuggle up.
Yeah. Would you say, because did you have chemo and radio?
Yeah, so I had the 8 rounds of chemo. I only did 1 cold cap.
Okay.
I couldn't hack it. I remember them going to me, if you can go through the first 10 minutes of the cold, you'll find the cold didn't bother me. It was the pressure it created in my head. I remember sitting there in this chair, like slomped with all this medication, and I'm going like this to my head to try and relieve the pressure. And they're telling you what to do with all these drugs after. And I couldn't take it in properly. I'm literally like, oh my God, the pressure. And they went, we can't go to the capsize out. I was, it's not going to work.
So is it like squeezing your head?
Yeah, literally felt like so much pressure because you've got it on before the pre-meds even start.
Right.
So you've got it on before then, the whole time of chemo.
Yeah.
And then you have it on so long after. I remember them taking it off. I had actual ice on my head.
Odd.
And I remember my head just didn't feel right. I felt headachy. And I remember my auntie going to me, what's the worst thing you're dreading? I said, the cold cap, because my head. She went, you've answered your own question.
Yeah.
So before the second round, I'd gone back to normal chemo without the cold cap, and then I could have it done at Broomfield, so I was closer to home rather than the over an hour journey.
Do you feel like the fact that you tried, though, at least you know that you tried, and if you never did,
and I was losing my hair before the second round anyway.
Right.
I was coming out in clumps.
Right.
Although they do say that your hair's supposed to grow back quicker with the cold cap, and I have kind of seen that with some of my customers.
Yeah.
For me, it wasn't worth it.
It's like personal choice.
Yeah.
What, for anybody who was thinking about having the cold cap, what is that process like? What do they actually do? I know that it extends your treatment, doesn't it?
Yeah, so you have it on before treatment. I can't remember if they sprayed it where it feels, although it went ages ago, it can feel like ages ago. I remember having conditioner put on my head.
Okay.
To slide it on. You got this like cap on it, and then another one on top, and it Velcros. I've actually got a picture of it. Velcros underneath, and you feel literally like squished, and then you're plugged into machines.
Okay.
So you're there a lot longer as well.
Yeah.
And the cold didn't bother me. It was literally the pressure.
So if the cap would have fit different, you might have been able to.
I don't know.
Maybe that's why people have different experiences.
But they now do it at Broomfield.
Okay.
So I did the 8 rounds. I lost my hair quite quickly, and I had the mesh integration on. So I personally wouldn't do it for someone.
I was just about to say.
Yeah, I think there's some people out there to make the money rather than thinking of the actual person.
I would never put it on. I do put it on people on long-term chemo.
Yeah.
So, like, if I've got a client on, like, tablet form chemo for 5 years and it might reduce the hair by, like, 50%, but we're really careful and we're really aware, then they will have integration on just to help them through that period of time. But you do have to be super careful, don't you, with that? And then I have other people who are going to be on chemo for the rest of their lives. That's just their treatment plan.
But there's different chemos. There's some that make you lose your hair quicker.
Right.
And some is like a gradual thinning.
Yeah.
So I would do it on a gradual thinning. Obviously, we've got to watch what we're doing.
Yeah.
But I would never do it on someone like what I went through.
I wouldn't
I feel
either.
like that wasn't thinking of me. I didn't have it on that long because I'd lost all my hair. It went on top first. I had this little bit here.
Yeah.
And your texture of the hair changes through chemo.
Yeah.
And it was matting. And I got to the point, I went to an appointment, I went, it's really, really itchy. And I wasn't mentally prepared to see my head.
Yes.
So that was quite a shock. And I couldn't stand anyone touching my head. Even a towel on it. It was so sensitive and sore.
Do you think that was from the chemo or from the
I think chemo can do it.
But maybe wearing the integration
But
on
I
top.
personally I wouldn't do it for some. I think they were just out for the money rather than thinking of someone's needs.
For me, with the emotional thing, like you put it on, they wear it for 10 weeks, 12 weeks, and then you take it off and then they've got no hair.
Yeah.
That emotion, that must be more traumatic
I don't think it was
than
that
shaving
long.
it off.
And I remember I held it together there.
Yeah.
And then they had to put tapes, the double-sided tapes, on it for me to stick it on. And I had to get my husband, because I didn't really know what I was doing back then, to help do it. And I cried the most for him to see me. That's when I was like, and my mum and dad. I didn't actually show a lot of people my head. It was my husband, my mum and dad and my boys.
Yeah.
But because I had the chemo first before the other treatment, so in the September I'd finished chemo.
Okay.
And that's when the little fluff was starting to go through. And I didn't want to have to shave patches.
Okay.
So then I got a wig quite quickly.
Yeah.
But before that, I remember that little bit, tiny little bit, was matting so much that I was worried what the boys would say, because at that point they hadn't seen my head. I'd hidden it from them.
Okay.
I remember saying to my husband, right, take it off in front of them, shave that bit at the back in front of them. And
Like
they
a
didn't
process
care.
for them.
I remember Ethan coming up to going, Mummy, can I touch? And he didn't care at all. I was worried that it would be like, that's not my mummy.
Yeah. I suppose kids, though, they don't necessarily relate hair loss to illness either, and they don't fully understand, do they? So
I used to go,
you kind of make it normal, then it is normal to them. Yeah.
Treatment is making mummy lose her hair, but it's making mummy better. That's what I used to say to him.
Yeah. I suppose that you're learning through that experience of your own definitely will shape what you do as like a hair loss specialist. I am really surprised that they actually put it on before, but it's a lot of money and a lot of trauma connected, and it shouldn't really create trauma. Like I have got a client at the minute, she's on tablet form for 5 years, 'cause it's hormonal, and she came in the other day and her hair's really, really like soft.
Yeah.
And we were talking, and she was saying like for the last 2 weeks before a tightening, is thinking about her hair.
Yeah.
And I was explaining to her, if it's actually not doing what it's supposed to do, which is stop the anxiety, it's just giving you a new anxiety, we need to look at something else.
Yeah.
Like if its job is to help you feel better, not like just give you a brand new anxiety. So we were trying wigs on and stuff like that. I think you have always got to be thinking about the client and their mental well-being.
You don't want to cause them more problems further down the line.
So once you were diagnosed with your breast cancer and you found out what type it was and you were given your treatment plan, were you told, did you have your operation first?
No, because it was aggressive.
Okay.
They wanted to whack it with the chemo first. That's why I had the 8 rounds of chemo first.
Okay.
And I had the first 4 rounds were 2 different chemo drugs every 3 weeks.
Okay.
And the last 4 was 1 chemo drug every 2 weeks. And so there weren't much break between those ones.
Yeah, that's a lot, isn't it?
And all of them gave me different side effects.
What would you say your main side effect? Or the thing you struggled with the most?
losing your taste. I couldn't sleep properly. They actually gave me sleeping tablets in the end.
Right.
I was like this, I'm so tired, but I can't sleep.
Is that the steroids?
Yeah.
Yeah.
And then the injections on day 3 to keep your white blood cells up, you count, to try and stop you picking up the bugs.
Okay.
Because you have no immune system. They made my body cane, the pain.
Okay.
And the last rounds of drugs, the last 4, felt like it crippled me. I remember crying my eyes out, even doing the stairs, just lifting my leg up. The aches and pains were horrific. So I'd probably say that was probably the worst bit for me.
Was it like muscular or it's more like
Both.
bone?
And because I had a PICC lining, I couldn't have a bath.
Oh, yeah, we were just talking about earlier, weren't we, how you love to be in water.
Yeah,
and that's how
I
you
relax in water. So I couldn't do that. Even when I had a shower, you're putting the sleeve over the PICC line. I had to be careful with the kids because you're not supposed to lift heavy. Well, I had to lift them. They were too young. They couldn't climb in and out of a car.
Oh, God, yeah, of course.
And I remember Ethan having a paddy once and it had come out a little bit because I couldn't have the metal claw in to keep it in place because I couldn't even cut an iceberg lettuce. It was too painful.
Really? What did you do to try and help with that then? Or did you just have to push through and just...
I just had to push through. I'd help with the kids when I was really ill, but when I pick up before the next one, I had to do bits on my own.
Yeah.
There was no choice. People have got to work.
Yeah, mentally and physically though, that's just absolutely exhausting.
Yeah.
But I know, like you were saying earlier, at some point you just wanted it to kind of be over.
Yes.
It's like...
Because they can't tell you, oh, you're going to be cancer-free by the end of it. They can't.
Oh, right.
So you have no clue if the chemo is going to work. So then I had, I even remember through chemo, I was getting these weird fizzling pains and the lump actually wasn't sticking out.
Okay.
So when I had the scan before the op, it had done its job. So then I had to have a full mastectomy, which I didn't know I was going to be cancer-free. I had a 1-year-old, a 3-year-old. I went for the quickest option, and that was the implant. So you're in and out the same day.
What options did they give you then? Like
What I've just had now, so it's called DEP.
Okay.
So you can either have your tummy fat or part of your fat reconstructed into the boob, or you have implant, or you have nothing. And for me, I'm not a confident person. I couldn't go without a boob.
Yeah.
So I went for the implant, had that done, and then I started radiotherapy in the December. Had 15 rounds of that.
15?
Yeah, and you go every day.
So you had so you had the chemo.
Yeah.
Then an operation.
Yeah.
And then radio.
Yeah.
Okay. I don't know why for some reason I thought it would be chemo radio operation, and it must be different for everybody.
The radiotherapy was more like a preventative, because they said because the type I had, it was aggressive, my age, it was just to hit the chest wall to give myself as much chance as it not coming back. Because with triple negative cancer, you are at higher risk within the first couple of years of it coming back.
Okay.
So they wanted to give it everything.
Yeah, give it your best chance.
Yeah.
Yeah. When you go for radio then, like when you go to chemo, you're there for quite a few hours.
I was there almost nearly the whole day.
Oh, really?
Yeah, by the time you have your pre-meds, wait for your chemo drugs to arrive, for all that to go through, I'd probably get there 9, and I was probably done by 4-ish.
Okay. And who was taking care of the kids then during that time?
I'm trying to remember what day of the week. I think it was a Thursday.
Yeah.
I think because I used to put them into childcare for 3 days a week. I'd have a day off with them, and then my mum would have them on a Friday. So I had one day missing. So people would either, my husband would take a day off or my mum would do it.
Can you even remember that time? Like, does it just feel like a blur? Because
it does and it doesn't.
It's like survival mode, just like...
Yeah, you are literally, this appointment, this operation, just to keep going.
Yeah.
So when it comes to an end, for me, it was a shock to the system. And that's when mentally I struggled. I remember being done, I was like, right, I've got no appointments, no more treatment. And I was like, what? And that's when it hit me. I was like, I've just had cancer. As much as I was getting upset through treatment, that's when it really hit me, was oh. And then I really struggled.
What did that feel like? Was that more
Mentally really not good. I was not in a good place.
would you say more like an anger or a depression or
Both.
Right, okay.
Both. Really massively struggling
With your
and hoping that it doesn't come back.
Yeah, so like the health anxiety as well.
Yeah.
So for somebody who was I think it's like the unspoken part of treatment as
Yeah.
well. It's like everybody expects you to get through the end and just be grateful that you've had this treatment.
And I think some people who don't necessarily know you that well, they're like, oh, she's finished treatment. She's all right now.
Yeah.
I'm not all right. I still have good and bad days.
Yeah.
Some days it hits me. Some days I'm like, let's get on with it.
Yeah. Why do you think people don't speak about it? Like the truth about the aftermath? Because it's a massive aftermath.
It is.
Yeah.
I don't know. I'm quite an open book, so I tell everyone everything, but I don't.
I think it's really important though. I think that that is what tends to shock people that I meet. Obviously,
Yeah.
I've never experienced it, but the people that I meet, the aftermath really is the part that knocks them.
Yeah.
Because they're on survival mode, like you say. You ain't got time to think about
and waiting for your hair to grow back if you've lost it.
Yeah, and
your body changes. I've now not got a boob. I've got an implant.
Yeah, at that point. 'Cause you've
Yeah.
had other operations since then.
Yeah.
What would you say to somebody that they could do in preparation for that period, or even like their families? Because I feel like, I don't know what your husband was like, but do families really know how to deal with that part?
I'm lucky that my family were really close. But even when I was going through chemo, as much as they're amazing,
Yeah.
I felt a bit alone. I did find, when I nearly finished chemo, did find a local group that helps people with breast cancer or already had breast cancer, and they do meetups, and that actually picked me up.
All right, okay.
But I had met someone while going through chemo, and I wished I never met up with that person.
Oh, gosh.
Because it's all well and good people saying this happened to me and that. That's why I always tell people, if they want to know my side effects, that happened to me. It may not happen to that person.
Yeah.
I remember coming over and going, you will lose your eyebrows, you will lose your nails, you will have the menopause. I was like, oh dear.
Yeah,
You're trying to depress me.
Yeah.
I was already depressed
Yeah,
before.
there's a difference between trying to like educate and guide
I didn't
somebody.
lose my nails. I haven't got the menopause because mine wasn't a hormone.
Yeah, that's just her experience.
Yeah. So I was like, don't tell me you will.
Yeah, it's like have the open conversations and let people know what could happen to
Yeah.
prep them, but you don't know there.
Yeah, so when people ask me, I will tell them about, but this doesn't mean it's going to happen to you.
Yeah, and I suppose different people struggle with different things.
Yeah.
So like you struggle with your hair, that
Yeah.
might not bother somebody.
Yeah. Some people rock the no hair look. I
Yeah.
wished I did, but that's not me.
I can't remember seeing you in that. Did I actually see you?
No.
Or did you do it as quickly as
did it.
possible? The flip
I
between
literally got quite quick. I remember my wig was a panic buy.
Yeah.
It was too tight, so I felt like I was wearing a tight headband here and it was uncomfortable. So
Yeah.
I got quite good at doing a little
Switcheroo.
Yeah, I'd be in the car and I'd have someone next to me and I'd do it so quick they actually didn't see my hair in the process of me going,
Yeah, swapping it
and
around.
putting it in the glove box.
Yeah. Yeah. So with, obviously, I think what I do see people experience is like you've just said, at the end of treatment, they have this big wave of emotion.
Yes.
And a lot of my clients are like explaining to me, I don't know if you've experienced this, but they almost like, they're grateful, but they're almost like angry, but then upset at themselves for not being like just happy that it's over. But the aftermath mentally and physically, like we say, it's not really spoken about. And I do believe that there should be more support there.
I couldn't get the support straight away. I waited weeks for the support I needed.
And what did that look like when you did eventually?
Cancelling. But it didn't help me.
Right.
I'll talk to anyone about all my problems. I'm not a closed book. I'm too open.
Yeah.
I needed ways of coping. If I got angry or upset, I don't want to harp onto it. I want to find a solution and move on.
Yeah.
Every time I went, we're just talking about the same stuff I talked to someone else about. I needed ways of coping.
Strategies.
Yeah, and I weren't getting it. So I didn't actually finish the course. I remember having a letter sent to the doctors that also came to home
Okay.
saying how I wasn't being very sort of helpful. And I was
What?
thinking, I'm too open. I've told you everything.
How can you not be
Every
helpful
time I
if
went, I need ways of actually.
Yeah, talking therapy is not for everybody then.
No.
Like when you're a hairdresser, we talk every day,
Yeah.
all day. Like that's not going to help you. And I feel like sometimes talking therapy, you can kind of sit in it as well.
Yeah.
Where, like you say, you're wanting coping mechanisms,
Yeah.
strategies.
If I'm getting angry or upset, give me a way to get over it quicker,
Yeah,
not to harp on because
Yeah.
I'm harping on about it.
yeah. How did your family help you, or did they just step back and let you process?
Their helping is they'll always listen,
Yeah.
always give me a hug. If I need them, they're there. But I don't think anyone can physically help you try and move past that. Even now, I'm not as bad as I used to be. Even now, I still have good and bad days.
Do you feel like though, because we'll go back to it again, but you've not really even finished, although you've finished
Yeah.
like traditional treatment, you're still going through a lot. Like, when did you just had an operation?
Yeah, I had
haven't
an
you?
operation in October, and that was a lot bigger operation and a longer recovery.
Yeah. So you're still recovering now, aren't you?
Yeah, I'm still a bit tender in places.
So we'll go back as well to that as well. But I suppose just because you finish chemo, you finish radio, everyone thinks that life kind of goes on.
Yeah, they think, oh, you're all right now, but no.
No, it can go on for a long, long time.
You're also left with the physical and mental scars.
Mm.
Like, I would say I'm not the Leah I used to be.
Okay.
I don't think you can go back to that person.
Do you think this version of you, though, has some good from that experience and some bad?
The goods from it, I'd say I appreciate things more. I get a lot more emotional about things. It might be just watching fireworks with the kids and I'll be crying or watching them swim.
I suppose you could have missed out on that, though. And
yeah, for me, it's like, I actually get to witness this.
Gratitude.
Yeah. And I'm now enjoy life, do things you want to do. Obviously, money can stop you doing certain things, but make as much memories as possible.
Yeah.
And when people moan about their jobs or something in life, and I literally now go, I've got worse as I got older. I literally go, if you're not happy, do something about it.
Yeah.
Life is too short. You don't know what's around the corner. If there's something in your control that you can do, change it.
So I suppose the negative is your patience. Not as patient.
I'm not as patient.
I'm the same though, and I've not even had those experiences, but spending time with women who would do anything for one more day, one more week, does make you
especially
less
when you
patient
get ones
with
that
petty
turn
things.
up that are terminal and
Yeah.
that hits home for me.
Yeah.
And I'm like,
yeah. The thing with cancer is when you get told in the beginning that word, everybody's gut reaction is going to be the same because you don't actually know your actual diagnosis.
Yeah.
When you hear those words, so you're all like on a level at that point.
Yeah.
So everybody's had that same experience that's been through it. But I, as somebody who hasn't, what could somebody like me do to help that? And this is one of the conversations that we were having on the way here that I feel is I do need to do like a full podcast on it because I think it'll shock a lot of people. A lot of the things that people like me might say or do that actually we think is helping but is actually really insensitive, or we're doing it to make ourselves feel better, but actually it makes the person going through treatment feel worse.
See, I even to this day, I still have to watch what I say because I don't want to upset someone.
Yeah.
So I still don't say that, Leah.
Yeah. But
it's just being as kind and understanding. For example, I went to some wig shops.
Yeah.
And I actually block out 2 hours for a consultation now.
Yeah.
So it's not rushed. I find a lot of people, if it's a cancer journey, they want to talk about it because they've not actually seen someone yet.
Yeah.
So it can go on for longer.
Yeah.
By not rushing it and consider this could be like the first time they're getting their head out, which could either not have any hair or a bit of hair, and that's a massive thing for people to do that.
Yeah.
It's just to understand that this might be a big thing, and they might be getting in a state coming for this appointment. I have a lot of people come and they're getting themselves worked up for this appointment. Then they do calm down, but it is a big thing. I remember going to the appointment and you're rushed. And I remember my scalp was quite sore when I was losing my head.
Okay.
So the wigs going on and off was actually irritating it.
Mm.
And I felt like there was no consideration to that. And also, I actually block my mirror sometimes. Not with everyone, just the ones that don't want to.
Yeah.
Because not everyone wants to sit bang in front of a mirror
Yeah.
and right under a spotlight.
Highlighting all the things.
Yeah.
Yeah.
And just staring at themselves and thinking, oh, this is me at the moment, but this doesn't feel like me.
Do you find that, because I find this, I don't know if you have the same experience, I find that the time that they come and spend might be the first time that they've actually been able to be honest about how they feel.
Yeah.
Because especially like women, we're nurturers, aren't we? So we're trying to protect our children,
Yeah.
trying to protect your partner, don't want people to know that you're actually afraid you might die.
Yeah.
So I find that when they sit in the chair, they'll say a lot of things that they might not say outside of the clinic.
I find it depends who they bring with them.
Yeah.
Because a lot of people will bring someone with them, and it depends if it's a daughter that they may not say
Yeah.
exactly how they're feeling, but if they're on their own, they might.
Yeah. Yeah.
So it depends who they bring with them.
That makes it a difficult one though, doesn't it? Because it's like they might need the support to speak up because somebody might not speak up. That's one of, like, when somebody's in a place of desperation, you don't want them to not say, oh, I'm not quite sure about the colour or something like that. So having a person with them might help, but then obviously it might stop them actually opening up.
Yeah.
And actually that appointment, even though it is about a wig or a hair system, sometimes it's a really good offloading session.
Yeah.
And then they can go back out and take on a little bit more of what they're having to deal with. So yeah, it is a difficult one. I find that with my regular clients as well, that they'll say things in the clinic.
Yeah.
And then they get to like wipe the slate clean and go off. Because like what I was saying earlier, a lot of the things that people say, not just like hair loss specialists, but people in general, like actually people don't want to hear when they're going through treatment. So things like, you're really strong and like
I've been told you're strong, you're brave, you're a warrior. And I didn't feel like that.
No.
At all. I was just fighting. But at the same time, there was times I'm not proud of, I wanted to give up.
Yeah.
I didn't want to be here.
Yeah.
Because I didn't know if I'd get through it.
Yeah. The physical and mental.
So for me, when people say that to me, I'm like, I really don't feel like it.
No. What could we say though?
I don't know, really. I don't think this is the right thing.
Yeah. I feel like maybe just holding space for somebody and allowing them.
To be honest, I end up hugging a lot of my customers. They end up hugging. Or I always go, if you need someone to talk to, I'm always here for you. Yeah. Don't feel alone. Because no one wants to feel alone. Even though they've got amazing family support or friend support, you can feel alone.
Do you think it needs to be somebody that's been through it that can help you not feel alone?
Honestly, when I found the group, it really helped me.
Were you just like together and that was enough?
Literally, I remember I was having a down day, and for me, it's a real confidence thing. Walking into somewhere, I don't know anyone. I was so nervous, and I walked in and I didn't want to go. And my husband's going, no, you need to go. I went, and I was having a down day, and I walked out and I thought, I needed that. I was laughing the whole time. They weren't depressive.
That's good.
It was a real laugh and a joke.
Yeah. Did you speak about treatment and stuff, or were you just a group of people together?
Do a bit.
Okay.
But there weren't one person that was sort of depressing you.
Yeah.
There weren't that. They're such a lovely community. I don't always get time to go to the meetups now, but when I do, I have a lovely time.
So you still go even now? How long has it been since your actual chemo now then?
What, when I was diagnosed, or?
Yeah. Like from the beginning, let's start from diagnosis to now.
March 2022 was when I got diagnosed. Then started the chemo in May 2022. Finished in September.
Yeah.
Then the operation was October. And then radiotherapy in December. And I literally finished 10th or the 11th of January 2023.
And in 2025, you still need your community. I think that's really important that people understand that that's okay.
Yeah.
I feel like a lot of people probably expect somebody in the family, they've had treatment and they're finished.
Yeah.
That's it now. That's park that and move on. But if you can still have your community and rest on other people, lean on other people rather.
Yeah, just because we're finished, it doesn't just go away.
No. So even now, so with your operation, you chose for the quick hyst operation
implant.
because obviously the children were so small. Yeah. But you've just gone back in and had reconstructive surgery again.
I wasn't actually informed that radiotherapy can aggravate the implant.
Okay.
Until my implant was in.
Ah.
And it like capsulated and it was all thick and hard and hurt. So when the kids were sitting on my lap and I read them a story and their heads on my boob, I'd literally go, or a hug, I was in pain. So I've been on a long waiting list. I waited a year and a half. And that's only because I got a cancellation.
Right, okay.
And I thought, oh, this is under 2 weeks to get my life sorted.
I remember that.
I know, I was panicking. But I thought, there's never a good time.
Yeah, I remember you messaging me, like, I'm having it done in 2 weeks. Oh, my God.
That's why I missed the ball.
Yeah, because we were supposed to go into the little lady lots ball. But definitely worth it. And we'll go next year, so that's fine. What does that operation... So if somebody is at the point now where they've finished their chemo or whatever, and they got the options for these 2 operations, what does... Obviously, your other operation was mastectomy, implant in. Not quite straightforward, but obviously you had your complications.
Yeah, in and out the same day.
Okay. But this operation...
is a lot more in depth.
Yeah. So
and a lot longer recovery.
Did you have where they remove a muscle or is it just the fat? Okay.
So it's called DIP.
Okay.
And they took the fat from my tummy.
Yeah.
So basically they cut you like hip to hip, take your fat out. They go into a bit of muscle to get a blood vessel.
Okay.
Take your fat. Take your implant out. They had to scrape all the scarring away. There was a lot of scarring.
Yeah.
Put all the fat up there. They've also connected a blood vessel to a blood vessel. I think it's by your ribs because they had to scrape a bit of my rib away as well.
Wow.
And they, sounds disgusting, they take a bit of your belly skin. So I've got a bit of my belly skin on my boob at the moment.
Okay.
And you can opt for having like nipple reconstruction, but I'm not bothered about it. So I'm not having that.
Yeah.
It was, I think, was it a 9-hour operation, something like that?
Yeah. That's like 3 operations in one, really, though.
Yeah, and they did a lift on my good boob, what I call my good boob.
Okay. Yeah, that's like a lot of operations, really, in one operation.
And you're in hospital. I can't remember, was it 4 or 5 nights I was in hospital for, and then you literally can't do anything for like 6 weeks or more.
Okay. With 2 children.
Yeah. So mum and dad stepped in as well with the kids and my husband because he would be at work and then come and look after me in the hospital.
What made you make the decision? Like, it's probably a personal question. You don't have to answer if you don't want to. But with the nipple reconstruction, is that just because you don't want to have an extra operation?
I was never fast. No one sees it.
Yeah.
And I've been without a nipple since the last operation. So I wasn't, it's not actually bothered me.
Yeah, so it's...
Whereas it does bother some people, so they do it slightly different. And then you go back for a phase 2 for the nipple reconstruction.
Right, okay.
So I was in hospital. I met a lovely couple of ladies in their little ward.
Yeah.
And it was a long recovery because my stomach cut wasn't healing very well. And then I remember the first time they tried to get you out of bed to walk and you can't stand up straight.
Is it like having a tummy tuck?
Yeah.
Yeah.
Because then they flip it all the way, the skin all the way back.
Yeah.
Because I had stitches here.
You had a stitch?
Stitches underneath.
Under your rib cage?
Yeah.
Okay.
So I was hunched over and you're like, what a... Because you can't walk properly and your back's killing. It's like you physically couldn't get straight.
Are they removing part of your... Are they removing like a a smile then, like they're doing a tummy tuck? Is that what
Yeah,
they're
so
doing?
you've
Then
got
they're using that for your breast. Yeah.
that line.
And then they're cutting through your muscle. So obviously that's why you
They went a
can't.
little bit in the muscle for the blood vessel, but they
Okay.
mainly just take the fat. But that line wasn't the worst bit. It was here.
Under the rib.
Yeah, that was the worst bit for me. The boobs, no, it was that bit was the worst bit.
Suppose if they've scraped your rib as well,
Yeah,
you're gonna like be really tender. So since that operation,
yeah.
how long would you say it was until you felt kind of normal? Like,
Oh gosh, I still, even to this day, I might get out the car and it's gone tight again.
okay.
So I'll be like, oh, it's pulling a little
How
bit.
long have we been?
Well, it was October. How long was
I
that?
don't even know what month it is.
Well, March. End of March.
We'll both start getting brain fog in a minute. That's another thing that you were saying earlier, wasn't it, about the brain fog and
Yeah.
everything.
I'll be mid conversation and I don't know what I'm saying.
Yeah.
It's actually, I find it quite embarrassing. Or I've known someone for years and I can't remember their name.
Are you just honest about it though and just say?
Yeah, because I feel like I have to be, because otherwise I look like an idiot. I'd say chemo brain is worse than baby brain.
Yeah.
And if I'm more emotional or more tired, it's worse.
Ah, okay.
It definitely is worse.
So your body still gets affected.
Yeah, I
Like,
still suffer with
aftermath.
aches and pains.
And what do you do to counteract that?
Hot tub.
Yeah.
I'm a water baby.
I would just think,
Just being in the water, I think the weight off of your body,
ah,
it feels lovely on the muscles and that. And if I do a mesh integration where I'm on my feet most of the day, I notice it.
do you have to have a rest day the next day? Are you
I
kind
tried to, but no,
yourself?
I haven't been that clever.
Probably need to, because you don't want burnout as well on top of everything else. So with all of that,
Yeah.
so you've obviously been through your treatment, and then like the boys are growing up.
Yes.
Because if they were 1 and 3 now, then what are they now? Don't make me do
Ethan's
math.
just turned 6.
Yeah.
And Callum was 4 in December.
So do they, although at the time you were saying they didn't really understand what was happening, do they understand now, or do they even ask, or is it just they don't?
If they see me, like my body, if I've got out of the shower or something,
Oh yeah.
they notice all the cuts and scarring. I remember the first time I got out of hospital, I stayed at my mum's at first, and my husband was trying to shower me and got me out. And I remember them going, "Oh, Mummy, that's a big car." And I remember getting out of the showers, and because a couple of times I'd have to put plaster on because I wasn't healing that well. And Ethan's like trying to hold me, and Callum's trying to hold me. Mummy, I'll help you.
I think
So they see that they have seen things, and they've been like, "Oh."
it'll definitely shape them into being really kind, caring boys, though. Like they've learnt to nurture really young. It's like as awful as it is.
They'd be like tucking me in with a blanket.
Yeah.
They are so sweet. They're serious mummies, boys.
It's like a silver lining, I suppose, isn't it, that you've seen that they've got that kind side. And
although I feel bad that they've had to go through it.
Yeah.
Because I feel like Callum's missed out, although he won't remember.
No.
But Ethan, he does remember a bit. So I do feel like he suffers with his emotions. And I think that could be part of me.
That could have just been him anyway. That's just
Could
like
be, but when the teachers and that are going on, it might be the trauma of, I'm not, make me feel any worse than I already do.
To be honest.
It's hard.
It's really inappropriate to say that to you.
I've had it a couple of times said to me, and I'm literally like bawling my eyes out because I don't want to feel like I've shaped his life to be an emotional wreck.
I don't think I think it's good for children to feel emotion. I think it's good for them. They've learned to nurture really young, the kind and caring. Like if you didn't go through treatment and they didn't have those experiences, they might be different kids, but that might not be better.
Yeah.
That could be completely different in a different way.
Yeah.
Do you know what I mean? Like all children experience some kind of trauma. It's normal to experience something. Obviously, that's not a nice thing for you to go through or for them, but you protected them as much as you could.
Yeah. And Ethan, I remember trying to tell Ethan that mummy's going to have surgery again, cried his eyes out.
Oh, did he?
Because he's such a mummy's boy.
Yeah.
And I was trying to prepare him that I'm not going to be around for a few days.
Yeah.
You're going to have to help mummy by getting yourself dressed and stuff like that. He cried his eyes out. His chin was going. It made me feel awful. So I haven't told him that I've got to have 2 more operations yet.
What are those operations?
So part of the fat in my boob's gone rock hard around the side. which they said is the blood supply didn't get to it.
Okay.
So they're going to take the fat out, the hard bit of fat, leave me 6 months, which I'm not looking forward to having a massive crater missing,
Oh.
and then re-put the fat back in.
How do you feel about that?
It's when I saw him and he said that, or he said, my only options are to do it or I leave it like it, but it's painful.
Okay, so it's affecting like your quality of
Yeah,
life.
so it's like either you stay like it and people get used to it, or you have it done. I said, well, I haven't really got an option, have I? There isn't really a good choice in my eyes.
Yeah, it's the best of like two.
Although they telling me it's not going to be as bad as what I've just had. It'll be day cases. I'll probably be going home with a drain bag.
Yeah, and how long will the waiting list be for that?
Who knows?
Okay.
Maybe a year or more.
Yeah, it just makes your treatment like so long though, doesn't it? And
Yeah,
you're
it
not
always
able
feels
to
like I'm
kinda-
waiting for something to happen.
Yeah. I think, again, like from somebody looking on the outside, probably just don't understand that part.
Yeah.
And that we need to be more patient with people and understand that
Yeah.
just because a certain part of treatment's finished doesn't mean that your worries and stuff haven't.
Yeah.
And that you are going to still have those moments of like anger and upset and
Yeah.
all of those other things. With them moving forward, I know you found like your group and everything.
Yeah.
But did you find any kind of therapies that have helped, or
No.
do you want to? Do you feel that you need to, or
Sometimes I feel like I could do with, like, when I get angry or upset,
yeah,
a way of dealing with it, which I still haven't found yet.
just some coping mechanisms?
But it's also life's so busy.
Yeah.
As struggle as it is keeping up with work life, mum life,
Yeah.
and doing everything around the house, that I already feel like I'm drowning. So it's like, where would I find the time?
To be kind to yourself.
Yeah.
You do need to be kind to yourself. Like that is like a massive thing. With your business now, because obviously you've really found like your niche and really
I can
aligned.
honestly say I absolutely love my job.
Yeah. I've loved watching you grow. It's been amazing.
And I actually don't think I would have got to where I am now without you.
Oh, thank you. Well,
No,
I'm glad
honestly,
that you really persevered
because a lot of people do the training and won't have the ongoing support. Like when I've done hair extension training before, there's no support after, you're left to it.
Yeah, it's so scary
But
that.
I've always been able to message you or call you if I need any help or anything.
Oh, just send me a wave because I'm rubbish at replying. Like, I'm terrible. You know I always will reply though, and if you really need me. But I just think what we do, it's so much more than just putting hair on somebody. So we do need that extra support.
Yeah.
Like I obviously have created a community, but it benefits me too.
Yeah.
And I'm grateful for you guys.
I honestly don't know how you do it all. The working, the training.
I love it.
And the shipping of the hair. I don't know how you do it all.
I don't either. I texted you this morning at 6:30. I said I've been up since 6:30 working. But it's when you're passionate about something, you do just push through, don't you? It's like you're saying with you, with your work, and then with your boys and stuff. Like you're taking on so much. But we do need to actually find balance.
Yes.
And lean on a community.
Yeah.
And make sure that we're helping each other.
Yeah.
Because it's a lot of responsibility with what we do as well.
Yeah.
And I think if you're there trying to do it on your own without any support, it's a lot emotionally to be doing. When I was first doing it and I was doing it on my own, there were moments like we've experienced together where I was like, I can't do this anymore.
Yeah.
Like, I don't think I can do it. I don't think I'm any good at it. I'm like, going insane. I had an experience, didn't I, about like, I didn't align with somebody and it nearly broke me.
Yeah. And then she tried calling me.
Yeah.
I can't on that.
Yeah. Like in every industry, you do get some people who don't understand what they need to do as part of the team. Like when we're doing someone's hair, it's teamwork.
Yeah.
Like we have to put the effort in, but also the person having it done.
Yeah.
And when it's only one of you, so if they was only putting the work in, but the stylist wasn't doing their part and vice versa, and that's what experience I had where the other person was not doing what they're supposed to be doing, and it did nearly absolutely break me. It was awful.
Yeah.
And I was on the phone to you, and I like.
I think we both had those moments where I've wanted to give up.
Because I love what I do and I take the responsibility really serious.
I do think it's hard though as well when you first start out getting people in. I struggled with that at first. I remember calling you. I was like, I can't get anyone.
Yeah.
And then I had the bad experience.
Yes.
And then
you've aligned properly.
I found someone, but that I offered it completely free of charge,
Okay.
including the hair,
Yeah.
which I remember. But for me, it was the best thing I could have done.
You felt like it took the pressure off.
It boosted my confidence again.
Yeah.
And she's still with me now.
Yeah. Yeah, and she's what I would call your muse.
Yeah.
So like I have my muse. She's still with me now. She's 86 now.
Oh.
Yeah, she's amazing. But she is someone who is really honest with me.
Yeah.
She'll chastise me. She'll tell me if something's working. If it's not working, she'll help me develop. She even taught me like special stitches because obviously back in her day you would have stitched your clothes and stuff. I feel like you do need a muse when you start.
Yeah.
Because kind of when you haven't worked out what kind of stylist you are and what kind of client you're aligning with, you can end up in a situation where you're not aligning with somebody and you're both having a bad experience. And that really does knock your confidence. I definitely know what I align with now, and I feel like you really do know who you align with. For anybody who wants to like work with you, what areas do people travel from to see? Because you're in Essex.
Yeah, I'm in housed in Essex, although I'm supposed to be moving, but not far.
Let's talk about that.
That's another story. I'm getting further distance now.
Right.
I've got Basildon, Brentwood, Ipswich. I'm going up to like an hour.
Okay, that's good.
And then I have actually got someone coming to me tomorrow for a colour match because I've already done the video consultation.
Yeah.
They're London.
Okay.
So it is getting further afield.
You were saying as well, like yours is based on more Google.
Yeah, I do more the Google ads. That's how I started the business. So I do the social media, but I don't get much from social media. I think people find me, look at my website, and then go and look on social media to look at my work.
Yeah, we've had totally different experiences because mine's the other way around.
Yeah.
But you must be good at Google Ads because I can't do it.
It does cost a bit, but that's where my
I don't understand.
My business comes from.
Yeah.
To be fair, I didn't set it up. My husband did.
Okay. Yeah. So if they want to find you, what is your website?
So it's www.personalisedbydesign.co.uk.
In Essex.
And it's personalised without a D because people want to put personalised.
Oh, yeah.
I didn't think that through.
Yeah, you can buy the other domain though and it'll direct it, so you can just do both as well. But I have absolutely loved watching your journey. Obviously, I met you after treatment.
Yeah.
And I just thought you were amazing. I didn't realise the day that you came for your training that you'd only finished treatment a few days before.
That's why it's flagging.
I was like, we had a little break in between.
I was literally set. I was like, I'm going to do it now.
Yeah, I just couldn't believe that you'd set yourself up to kind of.
I'm one of these people, if I'm going to do something, I'm going to start doing it straight away.
Yeah.
I've just had like nearly a year wasted.
Yeah.
Let's get that goal and get going.
And start the next part of your journey. And it has been amazing watching you, and I think the work that you do is incredible and beautiful.
You feel emotional.
It is, I love it. It's been amazing, and I'm really grateful for you coming today because I think being on both sides of like hair loss and treatment, it's nice to show people like the perspective from both sides, and that how much the empathy does matter because you've been really successful.
It took a while to get there though.
I don't think it has took you that while. No.
To me, it felt like it took a little while to get there.
I feel like it took you a while to find your alignment.
Yeah.
To like not just, I think that's the thing when you're starting a new business, it's just like saying yes to everybody.
Yeah.
Can like throw you off a little bit.
Yeah.
But I think once you've found your alignment, then you've just really thrived from there. Like your clients all look really happy and like you.
I love my clients. Honestly, they're like my working family.
Yeah. Yeah, I do. I think you need to give yourself more credit.
Thank you.
I think you know that anyway. I tell you all the time. But I'm super grateful, and I think it'll be really interesting for people to understand. And again, it's the same as we spoke about before, like understanding that they have to sometimes push for the diagnosis.
Definitely. I was going to say, if you're ever unsure, you can always get second opinion, third opinion.
Yeah.
Like for me, the biggest thing that makes me cross is people saying cancer's not painful. I've heard of several people saying their cancer's painful and mine was bloody painful.
Yeah, my auntie.
And I feel like that if you Google it, the main thing is that cancer isn't painful, and that is so wrong. So if you're ever unsure of anything, get things checked, stick your foot down. Don't worry what the doctors think. Because I used to be a bit of a pusher. I'll just take what someone's told me. Whereas now I'm like, no.
In my eyes, like, your red flags were classic.
Yeah.
Like,
I
I
remember
don't understand how.
when I said I was having blood come out, and I went to the specialist, a private one, appointment, and when the blood was coming out, it went, cysts don't bleed. I'm thinking, why doesn't a doctor know that?
Wow.
So it's scary.
That is scary. That is really scary.
So you have to push for things so bad now.
Fair enough if it could be two things, but if a cyst doesn't bleed at all and then the doctor's basically telling you, if you'd not had that private appointment, life could be very different.
Could have been too late for me.
Yeah, and thank God, obviously, you were able to do that. Unfortunately, not everybody is able to do that, are they? And
it depends if they can detect it themselves, something's not right.
Yeah.
'Cause sometimes you don't always know.
No.
With my grandparents, they didn't really know, and they were getting shoved off. So you've got to fight for it.
Yeah.
And it is bad that you have got to fight for things.
Yeah, everybody at the NHS under so much pressure.
Yeah.
I think the loudest voice is listened to, and as awful as that is. And I think there's a way of, like, because I have clients that work with you in the NHS, there is a way of fighting your corner without being rude to people that you don't need to be rude to. So, like, there's a way of doing it where you can be firm and really fair with the person. I think do your research and just let them know that you're not going to give up.
Yeah.
I've found, like, one of the things that seems to work is asking for your medical records.
Yes.
Because then they know they can't hide anything. And we had a guest on last Friday, and she was saying that before, when you request, if you request anything like a scan and you're told no, that you must watch the doctor write that down. Because if you request something and the doctor says no, and then at a later day it's not written down, it's like it never happened. So then you can't build your case saying, look, I've been asking since November 2022.
You don't always see them type, do you?
No.
They do it when you're
When
gone.
you leave. So she now is pushing everybody and make sure that you see it being written down, you know, it's, that you requested certain things and you want a valid reason why you're not being listened to.
Yeah.
So it's just those small things. So you don't have to be aggressive, do you?
Yeah.
But you can stand your ground.
Yeah,
Because
definitely.
a lot of people aren't confrontational. But
And I feel like sometimes, for me, getting a bit older, the kids and with the cancer, I am more forceful.
Yeah.
Whereas before, if someone said, no, you're not having it, I would have gone, okay.
Yeah.
Whereas I think life teaches you, you've got to be.
Yeah. And hopefully, like, people listening to the podcast, they can learn from others and kind of implement some things into their own lives instead of having to actually experience it themselves. Is there anything that you think you've not covered? The only thing I do need to ask is actually, let's go, because the whole point of the podcast is tell her. And obviously I think that you're like extraordinary and you're a mum. And then you're obviously doing ordinary things, which is like taking care of your kid. Well, we think they're ordinary, but they're not. They're absolutely amazing. But and part of the podcast is like what would you tell yourself?
Oh,
like,
no, this question.
It's like, if you don't want to, like, kind of tell your past self, what do you tell yourself every day when if you're having that bad day and you wake up and you're like, today's not good, like, what is it that you do or tell yourself to kind of push through?
I try to tell myself to look on positives.
Yeah.
Like, life is too short. You don't know what's around the corner.
Yeah.
Try and enjoy it as much as possible and make as many memories as possible as well.
Yeah. I know some days are more difficult than others.
Yeah. And believe in yourself.
Yes. Yeah.
Definitely. I'm saying it. I don't believe in myself a lot of the time. That's why you're looking at me like that. But no, honestly, you do need to believe in yourself, and I do need to actually take that in.
Yeah.
And that you can do it.
Because everything you've set out to achieve, you have achieved.
Do you know what? That's never actually crossed my mind.
Yeah, you have. And I think in a really short space of time.
Right.
You need to remind yourself. Tell yourself that.
Yeah.
Yeah.
And I have you to thank for it as well.
No, you've had yourself. Honestly, I'm glad that I've been able to support you. And it's been really rewarding for me, but you have done it all yourself. What I say and what other people say around you, they're words and they're there to support you, but nobody can do it unless you're doing it for yourself. You need to really give yourself credit. Be proud of you. Like, obviously, I'm proud of you, but being proud of yourself, that's really important. So thank you.
Thank you for having me.
And thank you for coming on. I think you did amazing.
Thanks.
Thank you. I don't even know what time it is.